Welcome everyone. How many times should intercourse take place to achieve a natural pregnancy for couples who have recently married, and is there any specific position that aids conception? I am Dr. Ahmed Kamal, a consultant embryologist in England, and in this series I will be speaking to you about ways to conceive naturally. We have previously discussed the prerequisites for natural conception: factors related to the woman, factors related to the man, and factors related to intercourse itself. I prefer to start with the subject of intercourse because there are many widespread misconceptions in our communities regarding it. In the next few minutes, I will address three questions. How often and at what time should intercourse occur? Are there any specific sexual positions that facilitate conception? Is it necessary to lie down after intercourse to conceive? Let us begin with the frequency and timing of intercourse. Many couples believe intercourse should be restricted to the ovulation period. This is actually a misconception. For conception to occur, intercourse must be regular, neither excessive nor insufficient. An exception applies to newly married couples. For newlyweds eager to conceive, I recommend frequent intercourse, ideally daily. Why? Because the woman's immune system must adapt to the presence of sperm. Her immune system must become accustomed to it, and the uterus must adapt to having sperm inside. Otherwise, each time sperm enters the uterus, her immune system will treat it as a foreign body and attack it. As we discussed in the previous video, each time sperm enters the uterus, the immune system mounts a natural immune response against it, as it is considered foreign. However, with frequent intercourse, the woman's immune system becomes familiar with the sperm, and the immune response decreases significantly. This greatly enhances the chances for sperm to swim through the uterus into the fallopian tubes and fertilize the egg. This may help explain why, in Islamic practice, the waiting period for a divorced woman is 3 menstrual cycles, while for a widow it is 4 months and 10 days before she may consider remarrying. Scholars have explained that this ruling was established to ensure the woman is not pregnant. Today, however, with advances in modern medicine, a single day of delayed menstruation followed by a blood test can confirm pregnancy with certainty. However, we have more recently discovered that the female immune system has a memory. It retains information about her husband's sperm. It takes approximately 3 months for this immunological memory to fade. If a woman remarries before this period has passed and attempts to conceive, her immune system may mount a heightened immune response against the new partner's sperm, potentially delaying pregnancy. Moreover, grief and emotional stress can prolong this memory, meaning the waiting period of 4 months and 10 days for widows makes physiological sense. Returning to our subject, frequency and timing. One major mistake couples make is scheduling intercourse strictly around ovulation, calculating dates meticulously. This approach can turn intimacy into a chore, creating psychological pressure. Such stress can result in further complications, including erectile dysfunction, premature ejaculation, decreased sexual desire, and other issues best avoided. Do not turn intimacy into an obligation. Enjoy the experience, and conception will occur naturally. Now to the second question, sexual positions. There is no specific sexual position proven to facilitate conception. Couples should enjoy intercourse in whichever manner is most comfortable for them. This leads us to the third question. Must one lie on their back after intercourse to conceive? I am aware that many may not heed my advice, but there is no such requirement. Once ejaculation occurs within the vagina, millions of sperm reach the cervix within minutes. During ovulation, the cervix is relatively open, allowing sperm to pass quickly. Cervical mucus also becomes thinner and more fluid, facilitating the sperm's swift movement. At the same time, a significant portion of sperm remains in the vagina. Regardless of whether one lies on their back or stomach, the sperm that remains inside will remain, and what is expelled will be expelled. If lying on the back provides psychological comfort, there is no harm in doing so, but it is not medically necessary for conception. This concludes our discussion on intercourse and conception. May you be blessed with healthy offspring, and I look forward to speaking with you in the next episode. Peace be upon you.